Okay, this exercise is called your deep neck flexor exercise, and what its intention is to strengthen the endurance of the deep neck flexors in your neck. So they're very, very deep muscles on the front of your neck, and you can't see them and you can't feel them. So to know that you're doing this exercise properly, you have to feel for other muscle activity, okay? And this exercise is really good for neck pain patients, any patients with headaches that are related to their neck pain, and any patients with poor neck posture. So typically patients with neck pain and upper shoulder pain and back pain will have this sort of head forward posture, it's called. And what the deep neck flexors do is they sort of pull you in to good neck posture. So ideally you want your ears in line with the tip of your shoulder. And the role of these muscles is to hold that posture throughout our day so that no abnormal stresses are put through our joints and our nerves. So what this exercise is it's a very gentle head nod, very, very gentle, okay? Now I've got Elizabeth here to demonstrate the exercise, and what I'm going to do, I'm going to go behind Elizabeth and move her head through the movement that I want, okay? So Elizabeth, the movement that we want is again a nod of the chin down, okay? But what you really want to focus on is sliding the back of the head up the bed and elongating through the neck there, okay? So this is the movement, okay? And really imagine sliding the head up the bed and elongating that back of the neck. Almost like you're lifting the skull off of the neck, okay? Now work with me as I do this. Good. Perfect. Good. Okay, just relax. Now, with this exercise, it's very important that you feel a muscle on the front of your neck. It's called your sternocleidomastoid muscle. Now, the way you can find this muscle is if you find your collarbone. So you find the collarbone, you follow it inwards until you find that nice big bump, and that's the joint where it attaches to your sternum, okay? So you find that nice big bump, you come up the neck about 1 centimeter and out about 1 centimeter, and then you'll find this nice meaty muscle, okay? So Elizabeth, I'll get you to feel the muscle on that side of the neck. So just right, yep, right there. And what I'm going to get you to do is to know that you're on the muscle correctly. I want you to lift your head off of the bed. Good, and back down. And if you're on the muscle, what you'll feel when you do that is you feel a really big bulge of that muscle as you lift your head off the bed. That nod that I showed you, just perform that for me. Good, and relax. Yep, and down, and up. Good. Now, you want to do this nod within the non-activity of these front muscles, okay? So as soon as you start to feel the muscle that you're touching bulge, and it's not a big movement, okay? It's a very slight bulge, but as soon as you feel that muscle bulge, you want to stop the nod and you want to come back, okay? Because if that muscle is bulging, that means that muscle is working. And we do not want that muscle to work, we want the deeper muscles working. So Elizabeth's doing very well here. So she's working within that bulge, and you can see it's a very small movement. It's not a big movement at all. And the way you can progress this exercise is you can hold it. So Elizabeth, I'll get you to hold that there. So you hold the nod for 5 to 10 seconds, and then you come back. Good. And go again, nod and hold. And again, you hold, so you want to hold the contraction just before this muscle here starts to activate. Good. And this is an exercise that you can't do too much of. So the more you do this, the better. You know, if you can do 200 reps in a day, that would be ideal. Not very realistic, but that would be ideal. You can progress this exercise to moving and sitting. So you can do the exercise in sitting with your head against the wall. And then you can progress that to further, you can move the chair further away from the wall so that your head has to lift up off the wall a little bit, and that just puts a bit more demand on those muscles. But yes, this is a great exercise to do to correct posture, and it also has been proven to give a bit of pain relief, a pain relieving effect for patients with neck pain.